For many years, every time you've gone in for a routine checkup, the focus has likely been on one number, your so-called bad cholesterol. The message has always been the same. Keep that number low to protect your heart and brain from heart attacks and strokes. And while that advice isn't wrong, it's only part of the picture. There's a silent killer that poses an even greater threat than cholesterol alone. One that's responsible for more stroke signs than any other risk factor in the United States. It's especially dangerous for those of us over 60, and the frightening part is this: it often goes unnoticed until an emergency strikes. Too often, people miss this hidden danger, only realizing it when the body sends an emergency alert in the form of a sudden health crisis. That's why knowing the full story is critical. In this video, we'll uncover what this hidden threat really is, why focusing only on bad cholesterol could leave you vulnerable, and how you can protect yourself with practical health tips and senior health tips that truly make a difference. And because heart and brain health are deeply connected, we'll also look at the surprising link between this silent killer and heart conditions like congestive heart failure, including natural approaches and congestive heart failure, natural treatment strategies you may not have heard about. The goal here is simple: to give you the knowledge you need to recognize the danger early and take action before it becomes a life-threatening emergency. We've learned to think of cholesterol as having two sides: HDL, the hero, and LDL, the villain. For decades, the primary strategy has been to control this villain. If your LDL level is high, the standard recommendations are to cut back on saturated fats and possibly start taking a statin medication. This approach didn't come out of nowhere. It's rooted in one of the most significant and influential medical studies of the 20th century, the Framingham Heart Study. This landmark, multi-generational research project in Massachusetts was the first to establish a clear connection between high LDL cholesterol levels and an increased risk of heart-related problems. This was a revolutionary finding that has shaped the medical advice we receive to this day. However, that's just the beginning of the narrative. As researchers delved deeper into the extensive data from the Framingham study, a more nuanced understanding began to take shape. They found that the total LDL number is a truly strong predictor of risk only at the extreme ends of the spectrum. 1. When LDL is exceptionally high, often above 100 mg/dl, the danger is undeniable. However, this level of elevation is frequently due to a genetic condition known as familial hypercholesterolemia. 2. When LDL is very low, below 70 mg/dl, the risk of heart disease and stroke is minimal. But what about the majority of us who find our LDL levels somewhere in the middle, in the normal or borderline high range? This is where the conventional wisdom becomes less clear. For a large portion of the population, especially those over 60 without genetic risk factors, the total LDL number can be a surprisingly unreliable indicator of true risk. It's true that studies have shown a correlation. Higher LDL levels are associated with approximately a 30% greater risk. But an association is not the same as a cause. Think of it this way: just because you see more umbrellas on a rainy day doesn't mean the umbrellas caused the rain. When analysts controlled for genetic factors and focused solely on the over 60 age group, the connection between the total LDL number and heart attacks or strokes became surprisingly weak. This raises a critical question. If the total LDL figure isn't the main character in the story of our heart and brain health, what is the real actor we should be watching? The answer lies in a detail that 99% of people, and even many doctors, overlook when looking at a standard cholesterol test. Imagine this common scenario. Your lab results show an LDL level of 100. What happens next? Almost certainly, you'll have a discussion about getting that bad number down, usually through a low-fat diet and a familiar medication, a statin. But here's a startling paradox we need to confront. Statins are one of the most prescribed medications in the world, and we've become much better at treating strokes and heart attacks with faster ambulances and more effective stent procedures. So, while the number of deaths from heart attacks has decreased, the total number of heart attacks is on the rise. We're getting better at putting out the fires, but we don't seem to be preventing them from starting in the first place. This leads to a crucial scientific question. A major clinical trial, known as the Accelerate trial, found that a drug highly effective at lowering LDL cholesterol did not actually reduce the risk of heart attacks or strokes. How could this be? How could lowering the very number we've labeled the villain fail to improve the ultimate outcome? And this is where we uncover the truth that most people miss, a secret hidden in plain sight within your own blood work. The standard lipid panel you receive has a significant limitation. It treats all LDL cholesterol particles as if they are identical, counting them as a single number. But the reality is, there are two distinctly different types of LDL. Think of your LDL as vehicles on a highway. The first type, making up about 80% of the total, is like large, fluffy cotton balls, large, buoyant LDL. They are big, move smoothly, and have a hard time squeezing into the small cracks in your artery walls. This is the type of cholesterol that increases when you eat more fat. And, most importantly, this is the type of LDL that statin drugs are most effective at removing. In essence, they are not the primary threat. They're more like big, harmless teddy bears. Now, let's meet the real culprit. Its name is small, dense LDL, or pattern B LDL. Imagine these as small, fast, and agile race cars. They only make up about 20% of your total LDL, but they are the primary cause of the accidents. Their small size allows them to easily penetrate the delicate lining of your artery walls, initiating the inflammatory process that creates dangerous atherosclerotic plaques, the very plaques that can rupture and lead to a stroke or heart attack. And here is the crucial point. This dangerous type of LDL doesn't increase significantly because of dietary fat. It skyrockets when we develop metabolic syndrome, a condition often driven by consuming too many processed foods, especially refined carbohydrates and sugar. This perfectly explains the statin paradox. The problem is that statins are like a highway patrol team that is excellent at catching the big, bulky trucks, large LDL, but often lets the smaller, more dangerous race cars, small, dense LDL, slip by. This isn't just a theory. The Jupiter trial confirmed a startling fact. Even in patients taking statins whose total LDL-C levels were brought down to very low levels, around 54, their risk of heart disease and death still increased significantly if they had a high number of these small LDL particles. This raises an obvious question. If the evidence is so clear, why does the medical system remain so focused on lowering total LDL for everyone, including those over 50? There are three main reasons. 1. Financial incentives. The role of the multi-billion-dollar pharmaceutical industry cannot be ignored. 2. The understanding that small LDL is the primary culprit is a relatively new discovery, and it takes time for this knowledge to become widespread practice. 3. Data from early statin studies appeared much more promising than their actual benefit for the majority of the population. Let's talk about that actual benefit. In trials, for the most ideal statin candidates, how long did taking the drug for 5 years postpone their death? The answer may shock you, an average of 4 days. So, what about the newer drugs? Medications like Repatha, evolocumab, a PCSK9 inhibitor, are indeed very powerful. They lower LDL, and yes, they have been shown to reduce the number of heart attacks and strokes. This is good news. But, once again, we encounter another paradox. To date, they have not shown a benefit in terms of overall longevity, all-cause mortality. This points to a critical truth. Simply targeting the total LDL number is like mopping the floor while the faucet is still running. We are treating a symptom, but perhaps we are missing the true root cause of the problem. Before we continue, if you're finding this video helpful, please consider subscribing to the channel. The root cause is a condition called insulin resistance, which is often the first step toward metabolic syndrome. Think of insulin as the key that unlocks your cells to let in energy from blood sugar. When you are insulin resistant, the locks on your cells become worn out and less responsive. In response, your body has to produce more and more insulin to get the job done. This insulin flood is the very signal that tells your body to create more of those dangerous, small, dense LDL particles. And what causes insulin resistance? The main culprits are typically a diet high in processed foods, refined carbohydrates, and especially added sugars. This is precisely why when people cut fat from their diets, they often don't see health improvements. They replace the fat with sugar and other bad carbs, inadvertently turning the faucet on even stronger. If you need more proof, look no further than the Lion Diet Heart Study. This research showed that heart attack survivors who switched to a Mediterranean-style diet, a diet rich in whole foods and by no means low in fat, had far better results in preventing future strokes and heart attacks than seen in the statin studies. So how can you tell if your own faucet is running? How can you get a truly accurate compass for your heart and brain health? The answer is right there in your standard cholesterol report, but it's not the total LDL number. Instead, look at two other markers. Number 1, triglycerides. This is the key player we need to watch. Triglycerides are a type of fat in your blood. Once they've done their job of delivering energy, the body converts them into, you guessed it, small, dense LDL particles. Therefore, your triglyceride level is the best indirect measure of how many dangerous, small LDL particles you have. In one large American study, 2/3 of all people who had a heart attack also had metabolic syndrome. And your risk increases by 80% when you have high triglycerides, a number far higher than the risk associated with total LDL alone. Number 2, HDL, good cholesterol. This is our ally. HDL helps clean out cholesterol from the arteries. Now let's put these two numbers together. The ratio of your triglycerides divided by your HDL, TG-HDL ratio, is your most powerful compass. It tells you the true balance between the bad guys and the good guys in your system. It is the best indirect way to assess your level of insulin resistance. What's the general rule of thumb? Triglycerides. Ideally, they should be under 100 mg/dl. If they are over 150, it's almost certain you are dealing with metabolic syndrome. HDL. For men, aim for over 40. For women, aim for over 50. The higher, the better. TG-HDL ratio. For Caucasians, if this ratio is over 2.5, it's a warning sign. For African Americans, that number is 1.5. So now you have the tools. The next time you get your lab results, look beyond the total LDL number. Find your triglycerides and HDL. Calculate the ratio. That is the true picture of your health. This is why major health organizations recommend that adults consume no more than 25 grams, or about 6 teaspoons, of added sugar per day. For decades, every routine doctor's visit has revolved around one number: your bad cholesterol. The message has been simple and consistent. Keep it low to protect your heart and brain from devastating heart attacks and strokes. But here's the truth. While that advice isn't wrong, it tells only half the story. Lurking in the shadows is a silent killer, a hidden danger even more threatening than high cholesterol. It's the leading risk factor for strokes in America, especially for those of us who have crossed the age of 60. The terrifying part? Most people don't realize it's there until an emergency strikes. Your body may try to send subtle stroke signs, but too often they're ignored until it's too late. By then, the emergency alert has already sounded and precious time is slipping away. That's why in this video, we'll uncover what this hidden danger really is, and why focusing only on cholesterol could leave you blind to other life-threatening warning signs. We'll also share life-saving health tips and practical senior health tips that can help you stay one step ahead. And because heart and brain health are deeply connected, we'll explore its surprising link to heart conditions like congestive heart failure, along with proven insights and even congestive heart failure natural treatment approaches that could make all the difference. Knowledge is power, and in this case, it might just save your life.